Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Rectal prolapse. The rectal prolapse types, it includes a mucosal prolapse, and this is very common. In case of children, it is very common. And then comes the rectal prolapse. That is in case of the full thickness prolapse, and it's mainly in adults. So one is the mucosal prolapse, other is the mucosal prolapse is in children, whereas the rectal prolapse is seen in full thickness prolapse is in adults. Now anatomically it is a reductant rectum. The redundant rectum is a redundant rectum and the weak pelvic floor. Redundant rectum and the weak pelvic floor muscles, it can lead to the rectal prolapse. Next is the prolapse is when the rectum goes inside the anal canal. Prolapse is when the rectum goes inside the anal canal and then it comes out. So how is the management? The management will be the mesh sutured around the rectum. So mesh is sutured around the rectum and it is fixed to the scrotum. So this is nothing but the rectopexy. This is nothing but the rectopexy. Then comes the excessive. So there will be an excessive rectal length. So excessive rectal length is excised and fixed. So it is excised and also it is fixed. This is nothing but the resection rectopexy. Then we have the anal wiring. Anal wiring is for the patients who cannot tolerate the length surgery. Can't tolerate the length surgery. So there is a narrowing of the anal canal to prevent the prolapse. So narrow of the anal canal to prevent the prolapse. Next, when you look at the rectal prolapse in case of the children, mainly there is a mucosal prolapse as we discussed and is often seen in case of the rural areas. The common cause includes the PEM, protein energy malnutrition, as well as the worm infestation and the diarrhea. This training wise, this is due to the underlying causes and can lead to the rectal prolapse, and which is often resolves on treatment of underlying conditions. Now, how to manage this? The management will be by the conservative management, and this is for common causes. And if the patient does not respond, so in case it does not respond, what do you do? Respond, you do the Lockhart mammary rectopexy. And for rare causes, what you do is the Thierch anal wiring is something which is done. Now in case of the full thickness rectal prolapse, this is seen in case of adults. So here you have the rectopexy. We have the abdominal perineal approach. To learn and grow daily like this, please do subscribe.